Hello everyone, I'm Utkarsh Yadav, counseling psychologist at TalktoAngel. Today we are coming back to our series on clinical disorders. Today we have Dr. Suri, clinical psychologist, to talk about what personality is and what are personality disorders. Welcome sir. When we normally talk about personalities, what interpretation that we have, how we can understand personalities?
Thank you, Utkarsh. As far as the personality is concerned, personality is a unique dynamic entity of an individual's thinking, pattern, traits, behavior and emotions, which make him or her a unique person and his or her adaptability with these situations and surroundings.
Thank you, sir. So, when we understand personality, as you talked about different thought patterns, different aspect of nature, how the person is. When we understand these personality, what are different personality types as we talk about in general understanding?
See, as far as the personality dynamics is concerned, personality dynamics has been divided into a trait concept and the characteristics concept. When we talk about traits, the traits have been defined by Cattell as 16 personality factors, traits emerging into factors. Then there are MBTI, which talk about unique dimensions of personality, features, extroversion, introversion, conscientiousness, and which makes him or her unique in terms of functionality.
Sir, as we understand that, as you talked about MBTI, there would be a lot of assessment which would help us to understand what traits, what types of the personality.
So when we talk about personality, it is not a physical appearance per se. As I mentioned, that the personality is a unique way and the dynamic of an individual to perceive the world with reference to thinking, emotions and his or her characteristics. Now, to measure the personality, there are different types of personality tools. The most common, we refer to them as TAT, thematic apperception test, which takes into consideration the themes of the individual, needs of the individuals, and the interpersonal relationship characteristics, etc. Then there are other types of the tests like Ocean test, the EPQ, the extroversion, psychoticism, neuroticism and life score. Similarly, 16-factor tests of this Cattell and MMPI, MCMI. There are large number of tests which are available. Some of them are true-false, some of them are multiple choice, some of them are semi-objectives, as I mentioned on TAT. And on a clinical dimension, the psychodiagnostics used by the Russia during the Second World War. Mm-hmm. So there are a lot of psychometric assessment which are available both for clinical diagnostics, are also available for career assessments, also available for promotions. The most common of them is the 16 personality factor, which is widely used both clinical setup as well as the career assessment or company they recruit for the individuals, their personality traits matching with the leadership, matching with the loyalty, etc.
Mm-hmm. Okay, sir, as you mentioned about some kind of clinical basis of understanding personality, and where we can understand that there would be certain personality disorder associated with the personality. So how do we understand what personality disorders are?
When we talk about personality disorder, it is considered that there are certain traits, certain characteristics, certain thought patterns of an individual which are deviant from their cultural and the societal as well as the norms, medical norms. Then in that circumstances, we consider them as having a personality disorder. The most common personality disorders are borderline personality disorder, narcissistic personality disorder, obsessive compulsive personality disorder, the schizoid personality disorder, schizotypal personality disorder. So these are the very common type of personality disorders which we often find in clinical population.
Okay. Sir, as you mentioned, different kind of personality disorder. We talk about BPD, we talk about narcissistic personality. So how these personality disorder actually affect the normal person when we see in terms of relationship and other aspect of life?
Yeah. So when we talk about the personality disorders, so there is a deviation from the cultural norm or societal norms. As a result, there are lot of emotional. The individual is not able to regulate their emotions, their thinking patterns are weird, or they are not able to maintain and sustain the relationship. And in a narcissistic personality disorder, he or she enjoys in terms of harming functionality of a relationship with the partner.
Okay. So as we understand, there would be a lot of emotional dysregulation, impulsive behavior associated with this, etc. So what are the treatment process, as you are a professional, what are the treatment process or diagnostic tool to assess it and get a proper therapeutic or counseling?
So as far as the personality disorders or deviations are concerned, the most scientifically accepted tool is MCMI or MMPI, which is very widely used, along with the clinical diagnostic interview by a trained professional clinical psychologist. In psychiatry, the medication is given in the personality disorder to manage the symptoms. So, say for example, some of the psychotic features are coming, like hallucinations or delusions. For that, the antipsychotic is given, or there is a extreme dysregulation of emotion, that very high elated moods are there. At that time, mood regulatory medications like SSRI are given. Or if there are excessive depressive symptomatology, self-formed thoughts, in that cases the antidepressants are given by a psychiatrist. However, I must put it across that NPD, BPD, schizotypal disorder or the schizoid personality disorder can be treated well, managed well, by virtue of providing family therapy, by virtue of providing the dialectic behavior therapy or CBT, or focused problem solution therapy. Majority of the time, if both the partners are having a NPD, then it is very difficult to change the pattern. But therapies are very, very effective. I strongly recommend taking care of these thoughts, emotions and challenges. I first and foremost thing is acceptance that I or my partner is having an issue. Then it is better to seek a professional help by a good clinical psychologist and have the dialectic behavior therapy or cognitive behavior therapy or EMDR, depending upon the specialization and the need and when required for an individual couple or an individual himself. It would be a big boon for them to take forward and get the treatment as early as possible.
Okay. Thank you, Dr. Suri. As we today understand about different kind of personality, how it is, and how personality disorders affect individual as per the diagnostic criteria, different kind of treatment. Thank you, Dr. Suri, for valuable information and for your time. Do subscribe the channel to know more about clinical disorders, what are the diagnostic criteria, how to understand its symptoms, and what would be the treatment process. We would connect again on the next episode of Clinical Disorders. Thank you.